Now, circling back to one of our top stories, hospitals across the country have sounded the alarm, warning that the Social Health Insurance Fund could collapse within the next 12 months if the financial challenges hindering its implementation are not urgently addressed.
This comes as members of parliament allied to former Deputy President Rigathi Gachagua demand answers from the government regarding the 104.8 billion Social Health Authority system, following revelations by the Auditor General that it is being managed by private entities.
Just days ago, private hospitals suspended SHA services of unpaid claims and an unsustainable reimbursement model, maintaining that they would only resume services once outstanding debts were settled.
Well, our reporter Noel Nabiswa with the details.
Appearing before the National Assembly Health Committee, representatives from Kenya Association of Private Hospitals, Kenya Healthcare Federation, Rural Urban Private Hospitals Association, and faith-based hospitals warned that unless more funds are allocated to primary health care, the fund will not be sustainable. The stakeholders criticized the Kenya shillings 900 annual capitation per family for outpatient services.
The money is not flowing. SHA is designed to raise money from various sources and then use it to purchase health care. And by design, except in one aspect, SHA is better designed than NHIF. So we are not advocating for a trip back to Egypt. We are saying we must continue the journey to Canaan by addressing those parts of the SHA design that are defective.
Kenya Healthcare Federation chairperson Dr. Gakombe revealed that while the government owes private hospitals Kenya shillings 30 billion in reimbursements, a significant challenge remains, as many non-salaried Kenyans contribute to the fund only when seeking medical services, but fail to make consistent payments thereafter.
For those who have paid for shift to get back the outpatient care that they used to be entitled to on a capitation basis, Chair.
His counterpart at the Kenya Association of Private Hospitals, Eric Musau, raised concerns over the lack of adequate safeguards to ensure the fund's sustainability. He pointed out that only 4 million non-salaried Kenyans, representing 22% of registered members, are actively contributing.
The average payout by SHA is between 7 to 8 billion per month. If the contract period is 90 days, it means that the people on this side of the house are underwriting a 21 billion credit line every quarter. So how do we work on that?
On his part, RUFA chairperson Brian Lishenga added that the fund has rapidly lost public trust, noting that the amounts being collected are too low to sustain the scheme.
The ministry has taken a decision to now move from sub-county based to county based. Now, while we as providers feel that this is a better approach, because then you don't limit a provider to a smaller population, their catchment is bigger, and also you don't limit patient choices. Because now patients, let's say you are on a border of a sub-county, if you are mapped to only your sub-county and your preferred facilities in the next sub-county, you can see what that means. You limit access.
In response, the National Assembly Health Committee affirmed its commitment to working with stakeholders to find a lasting solution that will prevent the fund from collapsing. Noel Nabiswa, KTN.
Moving on, President William